Hello, everyone. I am so excited to have you join us today with my good friend Lisa, who is here to talk about a topic that is much needed within the profession. And that's just making that decision to whether or not ancillary staff and having them on board is really worth it to you in your practice. Before we get started, just want to remind everyone this webinar is being recorded, and everyone who registered will receive a link to the recording after today's presentation. Please be patient because it takes about 20 to 30 minutes. Please submit your questions throughout the broadcast. Lisa is always getting tons and tons of questions. I want to make sure that we have time to get through those at the end of today's presentation. She is a frequent guest on our webinar series because, well, she's amazing. But she is the founder of Gold Star Medical Business Services, which she founded back in 2006 as a way to provide a home-based job as a medical biller for her then-disabled husband. Lisa has had over a 35-year career in the chiropractic, medical, and dental fields, including 10 years as a senior practice consultant and speaker trainer with one of the largest practice management firms in the U.S., which helped her to quickly turn a cottage business into a rapidly expanding medical billing company. In 2009, she left her consulting position to care for her husband and run Gold Star Medical full-time. And I will just tell you how we became friends. We met at an event. We utilized her in the practice. She is just positively, absolutely amazing. And then to top it off, the best part of 2018 is that I do have the great pleasure of getting to spend the weekend with her in a beautiful resort in Virginia for the upcoming spring convention for the Unified Virginia Chiropractic Association. So I am counting down the days. Lisa, I'm going to go ahead and turn it over to you.
Well, thank you so much for that introduction, and Christy, I can't wait to see you again as well. It's always too long in between our visits, but I'm just super happy that we're going to get to see each other, and I'm so pleased to be here with all of you. I love this topic that we're talking about. Christy and I were talking about it prior to the conference starting, and we both agree that this is a very, very much needed topic for chiropractic offices throughout the United States. And again, the topic today is on ancillary staff. Are they worth it? So we're going to talk about several different staff positions today that you could utilize in your chiropractic practice to facilitate some significant growth in your practice. And we're going to talk about how each of these positions function, what the average salary is for these positions, and so on and so forth. So let's go ahead and get started. In the beginning, when I first started in chiropractic, it was a pretty traditional staffing model. When you, as a chiropractor, for many of you, you're going to go into practice for yourself. Some of you may become associate doctors, but really and truly, the majority of chiropractors will go into business for themselves. And when you do, you're going to start out with a CA, and it's always recommended that a doctor work in the office with a CA for a number of reasons, for malpractice and for just having a professional image of your office to have a CA there working with you. But most of the time, doctors of chiropractic are going to start with one CA, and the way the division of duties work is that the DC will handle the clinical side of things, and the CA will handle the admin side. And so the DC, or the doctor of chiropractic, will do all the patient care, the therapies, and so on and so forth. And then the CA will handle the front desk duties and the insurance claims and so on and so forth. And as the practice grows, though, the duties become carved out and divided, and additional staff are hired. And as far as how that is done, it usually depends on the type of practice and the patient population. So, for example, if the DC is a fairly low volume DC or doctor of chiropractic, and yet he or she does a lot of therapy and rehab and has sort of a functional medicine type of practice, then the assistants is going to be needed on the clinical side. So in that case, the DC would hire a chiropractic technician to work in the back, and then the CA at the front desk would still handle the insurance and the front desk duties, and so on and so forth. And then, of course, as the practice grows, then the front desk CA position may be carved out to a front desk and an insurance CA. So you would have the front desk CA handling answering the phone, scheduling patients, over-the-counter collections, and general admin work. You have a chiropractic technician who is assisting the doctor with patient care, therapy, and rehab. And that would be like, if you were looking at a medical practice, that would be the equivalent of a nurse or a med tech in the back working side by side with the doctor. And then you have the insurance CA who would handle the insurance claims, verifications, billing, follow-up, patient statements, and so on and so forth, really basically all the financial side of things. And this is a very traditional chiropractic staff configuration. But as always in the medical field, things change, and things have changed significantly in medicine and in medical administration. Number one thing, that if you've been in practice for a long time, let's say 20 years or more, you will know that if you look at what you were being reimbursed for a spinal manipulation 20 years ago, and you look at what you're being reimbursed for spinal manipulation now, it's not that much more. I mean, you may be getting paid $5, $6, $7 more per manipulation than you were in 20 years ago in the late 90s or in the early 2000s. But in all honesty, the reimbursements have not kept up with inflation. And so what that requires is, in order to continue to be profitable, you need to do one of two things. You either have to get a higher volume of patients and bring a higher volume of patients into the practice, or you need additional ancillary services to be performed. And I know a lot of chiropractors now are branching out into acupuncture, physical therapy. Some doctors are now moving into the multi-specialty practices, which are awesome, and so on and so forth, weight loss practices. And so these ancillary services are added to add additional revenue and boost the service choices for patients. But the static reimbursements are also requiring us to bring more new patients into the practice to sustain the growth and profitability. Also, we have, and most of us are very, very aware of this, the increased compliance and documentation requirements for chiropractors are putting tremendous strains on your time. So if you're a doctor of chiropractic and you're listening to this webinar and you were in practice 20 years ago, and you think about what your documentation consisted of 20 years ago and what it needs to consist of now in order to protect your practice from insurance recoupments, in order to bulletproof your practice, so to speak, from having money taken back on audit and so on and so forth, the documentation requirements are tremendously higher than they were 20 years ago. And then finally, the way we are being paid is changing. And over the next 5 years, we're going to see significant changes in the payment models for chiropractors and for all of medicine for that matter, as payment is now being driven based more on the quality of care instead of the volume and instead of a fee for service. But what that means is, if you're going to be paid based on quality of care, you as the provider are going to have to quantify that. And how do you quantify quality? You do that through your documentation. You do that through reporting the quality measures to either Medicare or other payers as they now move into these quality of care payment programs. And then finally, we look at these high deductible plans, and these high deductible insurance plans are now requiring more monitoring and supervision of patient balances, because more and more of the financial burden of the medical service, whether it's chiropractic or just a general office visit by an MD, many patients are paying the majority of those costs out of their pocket. And so even though there's less insurance, there's more supervision required for the little amount that we get to bill for and get paid for, but we also have to watch the patient balances and make sure that the patients are paying their portion adequately. And so things have changed. So this is a big catch-22. It's like, how do we grow and keep up with the documentation requirements and keep up with the oversight of these patients and still be able to see the same volume of patients that we've seen in the past? And the answer is that it's almost impossible unless you change the way you do things from a medical administration standpoint. So I always say change requires change. Now that seems like a little oxymoron, but if you think about it, it's true. We can't change, and we can't expect to operate in the same traditional business models of the past when the whole nature of the medical business is changing. So the quality of care reimbursement models require us to have more oversight of that. The need for more new patients to drive growth requires us to have ongoing community advertising and outreach, and the need for precision documentation and the increased paperwork and time that's needed to comply with these requirements also creates the need for better efficiency and accuracy of medical records. I mean, look, for those of you who used travel cards, you could finish a note in about 30 seconds. Well, that allowed you to see many, many more patients than you could see now if you were operating within the documentation requirements that you now have in order to protect your assets, so to speak. And so we're going to talk about 3 specific positions that are a little bit different than your traditional CA positions. And as you're listening to me talk, I want you to think about the staffing model that you have now and how you could possibly shift job duties around and incorporate these different positions within your practice, and also ask yourself the question of when would it be appropriate to add these positions in the practice and begin to shift the job duties around a little bit. And we'll have plenty of time at the end for question and answer, so we can talk about the kind of how would we do this, and what would be, if I have this configuration of staff, how could I add these different staff positions? And so let's go ahead and first talk about the first staff position that I want to talk about that is a fairly new position in medicine is called the patient advocate. And on the medical side, it's also known as the patient representative. So it is not a PR representative, it is a patient representative or a patient advocate. And I'm going to, through the presentation, refer to this as a PACA, P-A-C-A, so which is the patient advocate CA. And let's look at the different duties or job descriptions of a patient advocate. So the patient advocate, when you think about this position, I want you to think about all things patient. So everything that has to do with the patient. What we're trying to do with a patient advocate is give the patient a go-to person in the practice. So if they have a question about anything, or if they have issues with anything relating to their care in the practice, they would go to their patient advocate for assistance. And so the patient advocate would be responsible for new patient scheduling, be a new patient liaison, and we're going to take every one of these bullet points and expound on them. So just hang on. The PACA would be responsible for handling all of the patient intake and the patient records. They would be handling the financial consultations and scheduling the treatment plans for the patients. They would be oversight of the quality control of that patient. They would be handling appointment confirmations and missed appointment calls. And they may also be working in conjunction with other departments on conducting healthcare classes for the patients. taking care of the patient statements and patient collections, recalls and reactivations, and patient education. So let's go ahead and take every one of these bullet points and expound on each one of them. So, new patient scheduling. In this, there would be a couple of options for the PACA to operate as a new patient scheduler. Number one would be the front desk CA. When a new patient calls in, once the front desk CA ascertains that it's a new patient, they would transfer that patient to the PACA for scheduling and patient instructions. Or the front desk CA could schedule the new patient and then transfer the patient to the PACA for patient instructions. And so what do I mean by patient instructions? So what would happen is once the PACA gets on the phone with the new patient, they would introduce themselves as their personal representative and liaison of the practice. They would gather any insurance information over the phone for pre-verification of benefits. They would direct the patient to the website for the new patient intake forms, or they could obtain an email address from the patient to send them their new patient forms. They can give the patient instructions. If your software program has a patient portal, the PACA would work with the patient on how to access the patient portal, give the patient instructions on pre-auths or referrals. So if it is ascertained that the patient has an HMO plan and a referral is needed, then the PACA would instruct the patient on what needs to be done to obtain that referral or that authorization for care. The PACA would be responsible for giving the patient directions to the clinic and confirms the appointment and callback number in case the clinic needs to reach them. All of these items of quality, this is all part of, when you look at the Medicare Quality Payment Program, these are all items that can be attested to as part of the Quality Payment Program. And yet a front desk CA typically does not have the time to do this with a new patient because the phones are constantly ringing, patients are checking in, patients are checking out. So if you have a PACA that you can transfer the call to, then that patient representative can sit down with the patient and spend a little bit more time over the phone gathering up some crucial information that can then help you better manage your patient as you move forward in that patient care. The other item of the job description is a new patient liaison. So once the new patient actually shows up at the practice, after they're greeted by the front desk CA, the PACA would take over and they would be the first person that the new patient meets. And so they would actually spend a fair amount of time with that new patient before the doctor of chiropractic even goes into the consultation area or the exam room. So they would be responsible for the greeting of that new patient, giving them an office tour, showing them around, taking them to the consultation area and then reviewing the paperwork with them, letting the patient know what is about to happen at that first visit. Maybe if there is a new patient video that needs to be shown, they would show them the new patient video. And then they could expand and go through even a consultation questionnaire. They could do a pre-consultation, which saves the chiropractor time, or you as the doctor time, in the new patient visit by having the CA go through the consultation questionnaire, and then you can just review the pertinent positive findings and pertinent negatives. And so depending on the size of the practice, the PACA might also be responsible for taking care of patient vitals, height, weight, blood pressure, pulse, and or any preliminary scans. So if some doctors of chiropractic like to do like a myovision scan or do the subluxation station, anything like that, you could do your preliminary scans and then have that patient ready to see the doctor for the exam, for the actual exam. And so, and you know, some chiropractors have the back office CAs do the consultation questionnaire, but that actually could be carved into the PACA role, leaving the back office CAs to do more of the therapy work and the rehab work, so they don't have to break off to take care of the new patients and the new patient consultations. And so this would be the essential functions of the new patient liaison. And so one of the things I want you to understand, and this is one way that a PACA can significantly help you with your bottom line on a new patient visit, is that when you're seeing a new patient, you're going to be performing a new patient exam on that patient. And there are 3 key elements to an evaluation and management code: the history, the exam, and the medical decision making. And many times when I do chart audits for chiropractors, I find extreme deficiencies in the history, to the point where it would actually create a situation where you would not be able to code let's say a 99204 because your history is not robust enough. And the reason for that usually is because you don't have the time to do a comprehensive history on that patient. And so the history, the elements of the history consist of the chief complaint, the history of present illness, which is essentially your consultation, the review of systems, and the past family and social history. And the ROS and the PFSH are all contained within the patient intake forms. So by having a PACA thoroughly review the intake forms with the patient, do a review of systems based on the intake forms, document the chief complaint, and document the HPI, you then can go in behind that CA and look at anything that basically sticks out and that you would want to expound on with that patient, instead of you having to sit there and do the same exact thing. This takes maybe 10 minutes to go through a complete history on a patient. So instead of spending the 10 minutes doing it yourself as a doctor, you have your CA handle it, and then you can still be treating patients. And for some of you, in 10 minutes, you can treat 3 or 4 patients. So think about the revenue that you can generate in your practice by simply giving this piece of your new patient service to your PACA or to a CA for that matter. Anyway, so this is one of the key areas that the new patient liaison would do. And you see, what's happening is when you have the patient representative or the PACA, they're getting to know the patient, and the patient is getting to know them, and they're starting to develop a relationship with this patient so that the patient will feel free to be able to ask questions of them, and so on and so forth. The PACA is going to be responsible for making sure that all new patient paperwork is completed, no blanks. They may be responsible for requesting medical records or radiology or labs from other providers as needed or if applicable, and then they would be responsible for the pre-consultation and the recording of the history of that patient. On the other end of the new patient exam and the report of findings, we have patients being presented with treatment plans by the chiropractor, and these treatment plans then need to be discussed with the patient from the scheduling and the financial standpoint. And wouldn't it be nice for those of you who are currently doing, as a chiropractor, currently doing your own scheduling of your treatment plans and doing your own financial consultations, wouldn't it be great to have somebody else on the other end taking care of this for you? So essentially what the PACA would do is, after the doctor has completed the report of findings and treated the patient after the first or second visit, just depending on your particular protocols, the PACA would then come in behind the chiropractor and schedule the patient for all the visits under the recommended plan of care. They would then discuss the insurance benefits if the patient has insurance, and then provide, based on the plan of care, the estimated cost of care. So you as the doctor would let the PACA know what the treatment plan is going to be ahead of time, so they can get the insurance verified and make sure that there is a fairly accurate insurance verification and estimated cost of care. At that point, the PACA can then discuss payment options with the patient, and if payment plans need to be set up, they can set up the payment plans. And so this is another great feature of the PACA. And when you look at these elements that I'm talking about, these are the elements that when I'm talking to CAs, if I go into a traditional chiropractic clinic and I ask them if they're doing these components of patient care, the most common response I get is, we don't have time. We don't have time to do this. And so, but the bottom line is that these are essential elements of medical administration that you have to be able to make time to do. And so carving this out to a PACA is a wonderful way to make sure that all of these elements are being taken care of. Under the quality control bullet point of the job description, the PACA would also be responsible for giving the patient some home care instructions. So if the doctor, you know, it's the same way, I don't know if you've ever been to the hospital, but you go to the hospital and before you're discharged, a nurse comes in and gives you your post-op instructions, what you need to do, what prescriptions you need to fill, if you need to go for physical therapy or whatever the case might be. In a chiropractic office, what we do is we give the patient home care instructions like icing instructions, alternating ice and heat, maybe some stretching exercises that they can do. They can give the patient a little bit of like an informed consent of what to expect after your first adjustment, letting the patient know that they may be feeling a little bit sore after that first adjustment, especially if they've never been adjusted before. And so it kind of heads the patient off at the pass so that if they go home and they do feel sore, if they continue to feel pain in spite of the first adjustment, they've already been forewarned that this is a possibility, okay? And then the PACA would also do a quality control call the evening after the patient's first treatment to make sure that the patient was satisfied with the service and make sure that they tolerated the adjustment and the treatment well. So that kind of heads them off at the pass. So in the event that, hey, they're not feeling better, then the PACA can instruct them to come back first thing in the morning, and then maybe even call you to say, hey, we have an issue with this patient. You need to give them a call and make sure that they understand what they need to do, and then then you can do that on an as-needed basis. And then, of course, confirm the appointment for the next day. The PACA would also be responsible for sending out the welcome letters to the new patients, which, of course, helps to generate more referrals to your practice. The other thing that a PACA will do, because they're the ones that are establishing the relationship with the patient, they're going to be responsible for appointment confirmations and missed appointment calls. So depending on the size of the practice, the front desk CA and or the PACA would handle the next day appointment reminders. And under the missed appointment calls, typically the front desk CA will handle the immediate, like 15-minute callback. So if the patient is scheduled at 10 o'clock and it's 10:15 and they haven't showed up, the front desk CA would handle that call. However, if they don't reach the patient, then they would send that information over to the PACA for a recapture of that patient the next day. And so what this does is that it will help close that gap of cancels with no reschedules and really help grow the practice. I mean, if you think about it, if your dollar visit average is, let's say, $50 a visit, okay, and I mean that's pretty conservative, and you can get 10 recaptures by having a PACA handle those recaptures. That's a $500 income right there, which is at least a third to a half of a full-time salary for a PACA. So I mean, it's really worth it to have the PACA doing the recaptures. Other duties that they might be doing would be a healthcare class. We also know these as spinal care classes, and I know some of you who are listening to this cringe at the thought of doing spinal care classes, but usually you cringe at the thought because it's you that has to do them. If you can have a PACA handle the spinal care classes for the new patients, that is a great way to increase patient retention and to increase referrals in the practice. They may help the billing department handle the patient statements and patient collections. And again, because the PACA has the relationship with the patient, if they call the patient about a past due balance, the patient is more in tune with them and they are more likely to respond favorably to that request for money than if they're hearing from just a somebody in the billing department that they don't know who they are. Recalls and reactivations are a big general duty of the PACA. So if they're not involved with patient care, they can be doing recalls and reactivation calls on patients who haven't been seen in at least 3 months. And then they can coordinate patient education programs with the chiropractor or the back office CA, the CT, on in-house patient education activities and events like the condition of the month and things like that. So those are some of the other duties that a PACA can do. The pay scale or salary for a PACA is similar as a front desk CA. It's not a more highly paid position. However, they do have to have a pretty good understanding of chiropractic and really be that chiropractic ambassador for you and be very, very enthusiastic about chiropractic, and have a great personality and a great warm rapport with the patients. You might want to consider incentivizing a PACA based on the number of recaptures or reactivations or referrals that come as a result of the work they do with the patient to help, encourage referrals of other patients. I can't get into all of that as far as the details of that, but certainly give me a call if you want more details on how to incentivize these positions, and we can talk about that a lot more on an individual basis. Your return on investment for a PACA is really far-reaching, and it is a little bit intangible. It's not like when we talk about the public relations CA, we can do a fairly solid ROI analysis, but the return on investment, I want you to think about these elements. Number one, increased reimbursement on the E&M coding due to just taking a better history. Increased collections due to advanced verifications and financial consults and making payment arrangements with your patients. Increased revenue by freeing up the doctor for more patient care. So while these consultations are being done, the doctor can still be treating patients. The revenue that is generated by mitigating the missed appointments and the cancels with no reschedules. And then, of course, the increased patient satisfaction that leads to a more compliant patient. All of these sort of intangible things, we can't really put a dollar amount on them, but I'm just saying if you can get the PACA to be handling the quality of that patient care, I believe that you would be seeing significant improvements in the bottom line of your practice, in your patient volume and in your patient satisfaction. So let's talk about the PRCA. This is probably more well-known than the PACA is at this point in medical administration. Many chiropractic practice management companies advocate for PRCAs because they are really, much of their management and consulting is dealing with growing the practice through new patients. And so a PRCA is a great way to do that. And so the basic job description of a PRCA is they're going to be responsible with the doctor for developing and maintaining an annual new patient activity calendar. They'll be acting as the community liaison. They'll essentially be the face of the practice out in the community. They'd be responsible for booking events, increasing professional referrals, creating copy ad and flyers for different types of new patient activities that may be taking place throughout the year. They would be responsible for maintaining and keeping up with the social media pages that you would be doing your outreach through, and developing in-house programs to increase patient referrals. So the new patient activity calendar, this is something that they would work with you as the doctor and other staff members to put together an annual calendar, make updates as needed, and of course, just because they are the PRCA, it doesn't mean that they're responsible for doing everything. They may be delegating some tasks to the doctor or other staff members to help implement some of these new patient activities. So, for example, if they schedule a screening out in the community, they may be delegating the massage therapists out and scheduling them to go out and help out at these screenings. And so, it doesn't. One of the things that I see happen sometimes when a PRCA is employed is everybody in the office takes a hands-off approach to new patient new patient activities. And that really shouldn't be. Everybody still needs to be highly involved in the new patient activities. It's just that now you have a captain, so to speak, who is steering the ship when it comes to maintaining and developing the new patient activity calendar. The PRCA would also be responsible to be a community liaison, so they're going to be the ones in the absence. If the doctor can't do this, they would be attending the chamber events and the networking functions, or maybe they would go along with you as the doctor, and then you could kind of divide and conquer and be doing some serious networking at a chamber event or a networking function. They would be responsible for giving talks on chiropractic to businesses and organizations, maybe form partnerships with local charities for fundraising, like coordinating a food drive within the practice or a charity golf tournament that you would sponsor or a fun run. These are just some basic ideas, and if you're interested in finding out more about these different activities, by all means, please call me and we can get into really the minutia of detail on these types of activities. Unfortunately, this particular webinar, we don't have time to really get into all of that. The other thing that the PRCA would be responsible for is booking events like health fairs, that you can make your own health fairs or partner with other groups. Find out if the local hospital is doing a health fair that you could get involved with, or sometimes the state universities or the schools will have health fairs. But the bottom line is somebody's got to do the research to find out, where you can book yourself for these types of community events. They may schedule lunch and learns for different businesses, or do dinner events or business recognition weeks. These are just some ideas to wet your whistle of, sometimes I have chiropractors ask me, well, what does a PRCA do? I mean, how can I keep them busy? And you can see by these different items that a PRCA can be kept pretty busy. Definitely at least 15 or 20 hours a week of outreach and community work, and then, of course, the other work that is done within the practice. The other thing that PRCA can help with is increasing professional referrals, so maybe conducting some luncheons for medical doctors' offices or attorney staff members to generate more MD referrals or attorney referrals, setting up lunch meetings between the DC and the MD or attorney, setting up maybe interprofessional social events. I've seen doctors and attorneys get together and basically invite their clients and their patients to a big picnic. And so everybody gets together and, you have that opportunity to do a patient or a client appreciation picnic. These are just, again, some basic ideas. The other things that they may do would be to creating ad and copy flyers. And of course, I personally think that for a PRCA, that's just a minimal part of their job. You don't want a PRCA sitting around just doing flyers and ad copy. That's not what where their value is going to be. They need to be able to maintain the social media pages and update them regularly, develop in-house programs to increase patient referrals. And so you can see that there are many, many things that the PRCA can be handling. They're going to be also paid a similar rate as a front desk CA, and for them, you would want to consider incentives or bonuses based on the new patient event and new patient goals met. And so obviously, a new patient needs to be quantified, and we can always talk about that if you ever need assistance on how do we quantify a new patient so we don't just have, the PRCA, bringing in warm bodies off the street that never really will convert to a new patient. You want to quantify that. So the pay salary is pretty much the same as a CA with some bonuses built in. Your return on your investment is easy to figure out. So what you need to do is, to get a good return on your investment for a PRCA, you need to collect some data. And that is, the data that you need to know is your case average. And your case average is essentially how much is a new patient worth to you over the lifetime of that patient. The formula is to take your total collections for the year and divide that by the total new patients. So if you collected $300,000 in 1 year and you saw 300 new patients, that's an average of 25 new patients a month. That leaves you a $1,000 case average. So what that means is that on the average, every new patient is equal to $1,000 in collections. And that's pretty good. Let's say you pay a PRCA $25,000 a year. At a $1,000 case average, you would need 25 more new patients per year to cover the salary, which is only 2 more new patients per month. It's kind of a no-brainer. If you want a 5-to-1 return on investment, what you'd really want to see would be about 125 more new patients per year. So basically, a third more than you currently are seeing. So if you're seeing 300, you want to see another 100 or more new patients out of the efforts of a PRCA. So that kind of gives you an idea of whether if you have a PRCA, you can assess whether they're producing for you that return on investment. And finally, let's just talk about medical scribes. Now, this is a fairly new position in medicine. It has taken hold of the medical community in a big way. I'm out teaching at hospitals and doctors' offices and multi-specialty clinics and multi-practitioner clinics all over the United States throughout the year, not just chiropractic. And many, many medical offices have moved to hiring medical scribes. Medical scribes, now what we're going to talk about here is coming straight from a great article on PayScale.com on research of medical scribes. And so I'm plagiarizing here. What you are seeing is from the article on medical scribes, and because they really synopsized the job descriptions of medical scribes in a great way. So the medical scribe performs a wide variety of transcription-related tasks, such as inputting patient data, recording exam results, and preparing charts. Depending on the facility or in the company, this could involve EMR, documentation, or physical paperwork. The daily operations of the position involve close work with the physicians and other employees in the medical environment. Medical scribes are generally directed or supervised by a manager, a nurse manager, or similar professional. Now, in the case of a chiropractic office, this would be the doctor or the office manager. If individuals who do medical scribing would have basic computer skills, excellent communication skills, and be able to use common office devices. Because of their job's access to sensitive information, I would recommend background checks and clean criminal records are required because they're going to be privy to a lot of PHI and a lot of sensitive patient data. So, in a nutshell, what a medical scribe does is they come into the treatment room with you. They will have either a computer screen or a computer in the treatment room, or many of them now are going to tablets, iPads, and they will follow you. And as you're treating the patient, you will be dictating to them your course of treatment, your plan for care, your future plan for care, the patient subjectives, the objectives, the assessment, and the plan, and they will scribe that note and transcribe that note at the time of the visit, so that when your visit is finished, when that patient visit is done, your documentation is also done. And it's not only complete, but it is thoroughly complete. It's not just a skeleton of a document. It is a thorough document that is going to withstand audit and withstand any type of possible recoupment. So the medical scribe's tasks, they're going to document medical visits and procedures as they're being performed by the physician. They're going to perform clerical tasks as needed by the physician, including faxing, phone calls, referral letters. So when they're not treating patients, they can be doing other clerical duties. Collect, organize, catalog data for the physician quality reporting system. So they would be responsible for getting into the registries and reporting the measures, if that's the method that you're using to report your quality measures, or making sure that the codes are being added to the quality reporting on the claims, that type of thing. They would also be responsible for alerting you when the medical record is incomplete or medical documentation maybe contains mistakes or inconsistencies. So they're going to kind of be a watchdog for you of your documentation. The pay scale for a medical scribe, again, is going to be very similar to that of a front desk CA or a billing CA. This is a great illustration of the pay scale. It's kind of starting entry level is around, for a full-time, around $24,000 a year. Late career up to about 31, 32,000 a year. So this isn't going to be a position where you're going to have to pay exorbitant amounts of money to do that, to have a medical scribe. But it is definitely going to allow you to see a much higher volume of patients, and in all honesty, just by virtue of the fact that you're getting your documentation done as the patient visit is being completed, you will find that this position would probably pay for itself within a matter of months every year, and then you would be in a profitable standpoint from there. This is just an illustration of some of the different medical administration salaries, and I've highlighted the front desk receptionist, the medical transcriptionist or scribe, and then the patient services representative, which is your PACA. And PayScale.com did a great analysis of the median pay of these different positions. And so if you look at the little orange bars, the dark orange bar is the median pay for these positions, and you'll see that a front desk receptionist median pay is somewhere under $30,000 a year. The median pay for a medical transcriptionist or scribe and patient services representative, again, is somewhere around $30,000 a year. So it's not going to be a big difference in salary from one CA to the other. Other considerations for hiring medical scribes, sometimes you can get a medical scribe pretty cheap, and when I say cheap, I mean free. Because if you're in a community with a local tech school or a community college that has a health information technology program, they may have internship programs for scribes. So essentially, you could sign up to be a clinic that accepts interns. It allows you to test drive the prospective employee, and if they do a good job for you, you can hire them right out of the med tech school. You would want to ask the school, if they do have a health information technology program, you would specifically want to ask the school if they have a medical scribe program. A general med tech may not meet the qualifications of a scribe because they're going to be dealing more on the patient care side of things, taking care of the vitals and so on and so forth. The scribe will be trained to handle all the quality payment program reporting and attestations that you don't want to mess with, but that are so important in allowing you to get paid more for what you do. And a scribe can also double as a credentialing specialist. So sometimes what I hear from medical offices is that the billers don't have time to handle credentialing problems, and so they can bring the scribes in to help handle the credentialing issues that, whether you're having to do reattestations to CAQH, or you're having to do a revalidation of your Medicare, or you need to be credentialed under a new plan or a new contract, the scribes can help out with that when they're not in the treatment room seeing patients. Your return on your investment, again, I can't give you the same kind of ROI as a PRCA, but the increased documentation compliance is going to lead to fewer claims rejections. You're going to make more money. Notes are complete when the patient visit is complete. It's going to save you time. And it's going to be a thorough note, and so, again, it will be more bulletproof to audit and possible recoupment. Time freed up from you having to do your notes opens up the opportunity for increased volume of patients. And let's just face it, it's going to reduce a major area of stress for you as a practitioner. I can't tell you over the last 3, 4, 5 years as the documentation burden has become more and more and more prevalent for chiropractors and medical doctors, frankly, how discouraged practitioners have become with practicing medicine. Some to the point where they just want out. They're done. They're like, I'm going to tap out. I don't want to do all of this documentation. And yet there's so many good years ahead of them where they still can be treating patients and doing what they do best, which is healing and servicing the public in a very, very special way. And for chiropractic, what we do is very powerful, and chiropractors can do what they do, well into their 70s. And that I've met chiropractors that practice into their 80s, and they do it because they love what they do. But the documentation is just so burdensome, they don't want to do it anymore. And by having a medical scribe handle all of this for you is just an amazing way for you to create longevity in practice and added revenue. Okay, so that brings us to the end of the presentation. I know I covered a whole lot of material in such a small amount of time, and so hopefully if I went too fast, you'll get a copy of the recording and you can listen to it again. Maybe use this as a staff meeting topic where you can take some of these different bullet points and talk with your office manager about the possibility of adding these positions or rearranging some of the current positions that you have in your office to accommodate these new ancillary staff positions. If you have or you need personally from me any information on either outsourcing your medical billing, implementing ancillary staff, practice management, or compliance, please feel free to contact me. My office number is posted here on the screen, and I have my cell number as well. And in all honesty, if you want to call me on my cell. I have no problem with that. I'm very mobile in my job, and so many times I'm not in the office to take the calls, but my cell is always by my side. So you can feel free to call me on my cell or fire an email off with your questions. Christy, I'll just go ahead and open it up for, the next 6 or 7 minutes for any questions that any doctors may have or they may have typed in to the chat box.
Thank you so much, Lisa. I don't see any questions, so if you have questions, go ahead and submit them now. We did have one comment. Dr. Terry, she used to be in Georgia, now in New York. Really enjoyed your webinar presentation. She misses having you as a coach, but she just wanted to say hi.
Oh, tell her I said hi.
Can you offer some specific incentive suggestions for PA?
For PA?
Yeah.
Practice administrator? Practice PACA?
Maybe that's what it is, because maybe it is a patient advocate.
A patient advocate? Yeah, some of the incentives that you can give the patient advocate would be, for example, if the patient advocate, let's say the patient advocate is charged with following the patient through a treatment plan, and that patient looks like they're going to drop out of the treatment plan because they're feeling better or they can't afford the care, and the patient advocate can prevent that from happening. And that patient actually completes a treatment plan. You could give the patient advocate a bonus for every patient that completes an entire treatment plan. And whatever, depending on your treatment plans and what that would essentially mean in revenue to you, it could be, it could be a small amount, or it could be a fairly significant amount of money, depending on, if it's a 36-visit treatment plan, and you can get a patient advocate to follow that patient and make sure they complete all 36 visits. My goodness, what would that be worth to you, and what would you bonus the patient advocate for doing that? You could, if the patient advocate is responsible for reactivation calls, and you could give them a bonus for every reactivation they get in the office. And so there's a number of different things that you could do. We could be creative with your office on bringing in a bonus system for a patient advocate.
those are some really great ideas. Let's see. I don't have any other questions. I do want to remind y'all next week we have 2 webinars next week, highly unusual. We have one on Tuesday and one on Thursday. The first one on Tuesday is Secrets That Super CAs Know, presented by Seth Soyring. She's going to be here on Tuesday at 2:15 p.m. Eastern Time. So it's a regular weekly scheduled webinar. Now, on Thursday, we have a special webinar at 1 o'clock Eastern Time for our ChiroTouch users on how to set up your ChiroHealthUSA fee schedule in ChiroTouch. If you're also using Cash Practice, we're going to review that as well. So if you will, that has very limited seating, so please go ahead and register now by going to our website at chirohealthUSA.com/webinars to register for those webinars. And we do have every webinar posted through the end of June, and you'll start to see the July webinars popping up in the next week or two. So got some really exciting new speakers coming on board for part of the webinar presentation. Lisa, do you have any closing comments you just want to share with them before we sign off?
I think the only thing that I would really want to say about this is sometimes we look at, as business owners, and doctors of chiropractic essentially are owning their own business, and sometimes you just look at the bottom line and think, well, I really can't afford this. I really can't afford another CA or another position. And sometimes we need to, instead of thinking about it that way, we need to think about what can I do to make this affordable for me, and how can I make this happen? Because sometimes, and I believe that if this is done right, the investment is definitely going to be worth the reward. And so, or the reward is going to be worth the investment, so to speak. And so I really, really would encourage you to seriously think about this, no matter how big or how small your practice is. Think about where your needs are. Are you needing just more personal time? Are you needing to get out from the documentation burden? Then think about a scribe. Start with that. If you're wanting to improve the quality of services and improve patient retention and patient compliance, then think about doing a patient advocate CA. And then, of course, if you're wanting to generate more new patients, think about a PRCA, because let's face it, the busier the doctor gets, the less time they have to do the marketing themselves, and they need to get help. And frankly, some doctors just aren't wired to do the PR. They need the new patients, but they're just not wired to get out there in front of the community, and so they need a face for the practice to go out and be able to market their practice within the community. And so just think about those things, and if you feel like you need any other advice, please call me. I do consultations all the time. I don't charge a penny for them. And then if we can do something for you, then we can talk about that. But honestly, just call me if you need any advice or additional information on anything that I've spoken on today. And that's all I have.
Right. Well, that was fantastic. We have our last question of the day. It says, when you're calculating new patient visits, do you consider a patient who hasn't been in for 6 months, or someone who comes in for a new condition, or only someone who hasn't been in for 3+ years?
When I'm calculating new patients, I use the traditional method just so that there's no question. A new patient is classified as such if they've never been in the practice, okay, or if they haven't been seen in at least 3 years. So for example, when you're coding for a new patient visit, that is the criteria for how to code a new patient visit, is if they've never been seen or if they have not been seen in at least 3 years. And remember, if you have like a multi-DC practice, let's say you have 3 chiropractors in the practice, if a new patient comes in and sees Dr. Jones and then 6 months later they come in and see Dr. Powell, that's not a new patient, because if all the 3 DCs work in the same practice, they're not of a different medical specialty, so that is still considered, even though it's a new patient to the other doctor, it's still considered and coded as an established patient.
Great answer. Well, we are right at the end of the hour. Again, thank you so much, Lisa, for being part of the webinar series. I just love every topic that you talk about because you always change it up, talk about the things that are really important in the practice, but it's not the same old that we hear from everybody else. I appreciate it.
Well, I appreciate you, and you know how much I love presenting for some of my favorite people. So.
Well, thank you so much. I hope everyone has an amazing rest of your day and a fabulous week, and we look forward to seeing you next week for our CA seminar with Zest. Y'all have a great day. Bye-bye, everyone.
Bye-bye.